Thanks, Rob, and good afternoon, everybody, and welcome to this Health Tech World event, today focusing on the digitisation of mental health. We're streaming live, but this is being recorded as well, and we'll load all of the content from today's event up onto YouTube next week, so you'll be able to share it as widely as you'd like to do. We've got a fantastic group of panelists today to participate in this discussion, all experts in their own right. I'm not going to introduce them. I'm going to ask them to do that themselves and say a little bit about their organisation and their areas of special interest. And then we'll get into the central part of the conversation today. So if I could start with Tim. Tim, would you like to introduce yourself, please?
Yeah, absolutely. Thank you, Alistair. And thank you, Health Tech World, for setting up such an interesting discussion today. Nice to be on such an esteemed panel. So Tim Dunn, I'm the Chief Commercial Officer at OneBright. I've been there around 6 months. The majority of my career was spent within the private medical insurance industry. For those that don't know OneBright, we are a mission-driven organisation to create a brighter tomorrow by providing easy access to life-changing and personalised mental health services. And we do that through a foundation of clinicians. We accompany an employed group of talking therapists across counselling, CBT, EMDR and into psychiatry services, which has grown considerably. Even in the last 6 months, I think we've doubled from an employed clinician perspective up to about 115, alongside a network of therapists, again, across a number of different modalities of 4,000, which provides the largest provider of outpatient mental health services in the UK. The majority of what we do power the sort of insurance industry, so behind some of the biggest brands in PMI and across into other services that generate the need for clinical intervention, so grouping of protection, occupational health, EAP, and then dealing direct to corporates. I think the most important part for us and interesting to discuss today is the connectivity between using digital solutions, the enhancement in technology that solves some of the demand and supply issues. The demand is increasing, as we all know, across the UK. One of our jobs is to create and manage that supply. For us, and where we're investing, is really about making sure we can connect and match that supply to demand and keep up with it. So technology plays a huge part in that space. So interesting to talk more about that as we go through the session.
Great, thanks very much, Tim. Phil?
Very nearly did the you're on mute piece. Thank you very much, and thank you very much for having me today, Alistair. Phil Worms, CEO of a company called Frog Systems, based in Glasgow in Scotland. And very simply, we exist to support people through their ups and downs, or through life's ups and downs. And we do this, we consider ourselves, if you like, first line support in providing people with access to holistic materials, content, which we believe will benefit them at the point of need when they're first on that journey to try and understand what support and help is available for them. So we literally very much focus on a personalized and holistic platform, which covers topics from suicidal thoughts through to the menopause, through to financial wellness. And it's very much based, our whole sort of raison d'etre is based very much on a quote that Desmond Tutu famously stated a few years ago, when he said, you know, why do we keep diving into the river to pull bodies out? Why don't we just move upstream and stop them jumping in?
That's great. Thanks very much for that introduction, Phil. Thomas.
Hi, thank you, Alistair, and thank you, Health Tech World. I'm Tom Sang. I'm the CEO and co-founder of Valera Health. I'm actually based out of New York, and we are a virtual telemental health clinic serving approximately 9 states now in the US marketplace. And we're a dedicated group of mission-based clinicians. We have roughly about 450 providers, and we are a B2B to C model, meaning most of our visits, over 99% of our visits, are covered by US-based health insurance companies that covers close to 39 million lives. And we're kind of unique in this segment in that we serve both mild, moderate, as well as patients with high acuity conditions and severe conditions such as schizophrenia and bipolar in a virtual manner. And a little bit myself, I'm actually an internist by training, but I've been involved with policy and technology over the last 3 decades. Thank you.
Thanks for that, Tom. Emil.
Hello, everyone. My name is Emil Jimenez. I'm the CEO of MindBank AI. So MindBank is a platform that we believe will change humanity because the next personal computer is you. The way we manage MindBank is that imagine it's like a data lake of the human. And it's a very simple chat interface where you speak to the digital twin, ask you questions about your life. You answer these questions and we analyze them for psycholinguistic information. Yet as you build this digital twin through this data and this interaction, you create a knowledge graph of the person that can not only serve as a baseline for personal and psychological data, but it could also help you with your personal development and self-care. And really that's our mission, empowering people with their personal digital twin data so that we can move the industry from healthcare to self-care. While a lot of the colleagues in the panel are, let's say, on the clinician side, we look at it from the consumer side. How can consumers be more empowered with their psychological, their mental and physiological data in order to change the industry from a healthcare system to more of a self-care system and empower them in that? Because we believe that the healthcare system, and I guess that's the purpose of this conversation, it's going to be very hard to scale this as we age. So there has to be a lot more digitization and a lot more tools to empower users to self-care and empower the physicians and the clinicians to use this data to provide better care. So this is where we lie in this, and that's the purpose and the mission of MindBank. So thank you.
Thanks, Emil. And I'm sure we'll come back to that concept of self-care during the course of the discussion. If I could ask you, Derek, to introduce yourself next, please.
Good afternoon, everyone. Really great to be here. Looking forward to the discussion. My name is Derek Richards. I'm the Chief Science Officer with SilverCloud Health. SilverCloud Health are a global company and a digital mental health platform. Actually, this year we're a decade in our commercialization journey. Previous to that, we spun out of academic research. That's my background. And we started initially in depression and anxiety disorders and delivering structured cognitive behavioral therapy protocols with clinician support in the loop. We expanded those program ranges to about 30 plus programs now, addressing not just core mental health, but also the behavioral aspects of several long-term conditions, and indeed some of the more wellness interventions, such as management of stress or resilience. We operate across Europe. We also operate in Australia and the US and Central and South America. We have a large footprint. We've been very fortunate over the years to really attract some good funding to keep us going, which is always important. And then our most recent success really has been last year. We were acquired by Amwell, which is a telehealth company. And this brings a new chapter for all of us in terms of where we're going and what are we going to do next together. And we are now really focusing on an overall strategy of kind of really delivering a step care digital mental health model, where we can map acuity of need to the right intervention at the right time. And that's going to implicate an awful lot of not just new content development, pathway development, bringing in some machine learning, AI, and other devices, etc. That's a little bit about our history, an overarching perspective on our strategy. And then within that, I suppose, some key areas I'd like to mention just, or maybe that's the next thing, I'm not sure, but anyway, I'll go ahead. Is like, we've been doing a lot of work on children and young people now recently. Historically, it's been adults, but really there's a huge need in the delivery of services for children and young people. There's also a need to really think through and conceptualize digital for secondary care, step 3, higher acuity, and also then a real focus and an increasing focus on mobile and devices, because we see them being used increasingly. So great to be here, and we look forward to the conversation with everybody. Thank you.
Great, thanks very much for that, Derek. And last but not least, Pete.
Good afternoon, everybody. My name is Pete Trainer. I am here today in my capacity as an International Advisory Board member for Headspace, which is a holistic health and wellbeing platform, which I'm sure many people listening have heard of. In my previous life, I was the founder of an AI and NLP based business in London called Nexus. We were building some fairly bleeding edge technology about 10 years ago in the space of mental health automation. Our specialism, my specialism, is in what we classify as hallucinogenic care. So we were looking, my business was looking for the causes of physical and mental ill health, so further upstream interventions and not just treating people when they were getting sick. And I'll bring a bit of that into the conversation today. I've also done I've been an advisor for the UK government on the ethics of some of this technology, and also the causes and implications of digital on the population's mental health. So I'm going to bring that perspective, I think, today, probably not just the things that we can do to support, but the things that perhaps technology is doing to create the mental health pandemic that we might be facing. So that's kind of my important topic, actually. That's the thing that I hope we cover in today's conversation.
Great, thanks very much for Pete. We'll definitely come back to that. Pete, maybe as you're on, I could ask you to start by saying a little bit about the role of data in developing treatments specifically and identifying issues with reference to mental health.
Yeah, okay. I mean, I think the one thing that we should just mention straight away is that we can't avoid data now. We're all generating it in ridiculous quantities. I'm not going to use any memes or idioms, but everybody has a footprint with delivering data to servers in vast quantities. Now, within that data, there is inevitably going to be a certain amount of psychometric. So we know we can use the information that you're generating on your phones to look for some of the causes of mental poor ill health on a kind of continuum as well. So from very loose, small mental health conditions to very big ones. And that goes to everything, to your spending behavior, to your telematics, to all sorts of data. I think the big thing that we need to get right when we're talking about data and mental health is the ethics around this. That data is owned by the individual. I don't care what anybody says, even businesses that I've supported, you do not own that data. The individual has to own that data. It's their psyche. And also how we cross-reference that data with other people's data in order to be able to predict, analyze, and create interventions. I think that's really important as well as we look at the ethics of some of this stuff. I think to end my point, it's unavoidable that data is going to fuel every single piece of technology that we're here to discuss today. But I think we have a responsibility to do it properly. And what I've seen is in the last 10 years, there have been an awful lot of companies that are just doing this, or an awful lot of individuals that are creating technology on a crusade to help with the problems that we have. They're not necessarily stopping and thinking about the implications of what they're spewing out into the world. And so I think regulating this space is going to be really important. DTX, so digital therapeutic regulation, is going to be very important. And making sure that we talk about ethics in every single thing that we do regarding data and our mental health.
Great, thanks for that, Pete. Phil, I know that you've been doing a lot of work around personalisation. I mean, data is obviously central to that. Thoughts?
Yeah, no, very much so, and totally concur with Pete's opening remarks there about the ethics. I think one thing that we really have to address, and get this on the table very quickly, is exactly what data or what is my footprint going to be used for. And it's all very well saying things like, oh, well, we don't actually look at your data, or, it's not being used for third-party advertising, or your line manager's not looking at it. but we have to make that very, very clear and transparent. And I think one of the big issues that we face in the tech world at any level is, convincing people that we can be trusted. And I say we in the royal we sense, that we are not going to, mine 100,000 people's worth of data and then sell it on to a third-party supplier that they can then target with adverts, et cetera, And I think also we have to be, and I think, the pandemic has shown us this as well. We also have to be very, very wary, and we need a very transparent, I would suggest, government policies here on how government and policymakers are going to ask us to use our data. You can hopefully it will never happen, so I'm just going to use this as a terrible example, but if we had something where in order to clock in, as it were, at your place of work, you had to show some form of "I'm not suffering from this today" type thing, and it's couched in terms of well, that's part of your well-being because we'll be able to treat you and help you, et cetera. I guess it sounds a bit Big Brother, but I think we, as well as focusing on how digital can quite rightly be used as an intervention, and can quite rightly be used to help people that are struggling with all sorts of issues, it's got to be on a playing field where it's trusted. And we've got to work, I think, just as much on cultural and behavioral change as we do on the digital platforms that we're all working on.
Thanks, Phil. Tom, that question of the sort of big dividend that sits there behind the effective use of data and some of the barriers in terms of trust, would you like to say a few words about
that? Well, I come from both the clinical world, but I also, having spent a stint at Merck Pharmaceuticals, I appreciate the evolution and also the process of novel drug development. And I think it's really in both worlds, there needs to be full transparency of the purpose of data use, what's going to and how's it going to be used, and the parameters of privacy. And I think as long as that transparency is made to the patient with full consent, I think it's really informing the patient that would they like to contribute their data to intentionally useful purposes like drug development. I totally get I think issues like selling data, third-party vendors and marketing purposes is, I do think it's inappropriate. But in moving and pushing forward a scientific agenda, developing new drugs, looking at clinical trials, I think all of that with full transparency and a full consenting process should be instituted in organizations engaging in secondary uses of data.
Thanks, Tom. Emil, moving along a little bit from the use of data to digital technology more widely, you talked about that journey towards self-care. Could you say a little bit about how important investment and development of new forms of digital technology will be in making that journey, and maybe say a few words about any barriers that you see?
Sure. So I get to kind of go on the long tail of the last discussion. Obviously, trust is a barrier to the consumer, but what we're seeing is perception is also geographic. So a German consumer is very different from an American consumer, by hands down, and UK as well. So we do see that geography plays a role in the level of trust and the level of openness. But to the point of everyone else, as long as you're transparent, you're decentralized, meaning like you own your data and you control your data, and you're also providing value to the community in some way, either personal value by monetizing on that data, or personal value by helping the population health, right? There's all these barriers, but ultimately we see it from that perspective. When it comes to the self-care, what's really happened, if you look at it, we look at it from an anthropological perspective. For millennia, we had a process of self-reflection, self-care, and community guidance, I'd say. And most recently, like obviously a lot of it's gone from let me take care of myself and be empowered to I'm dependent on someone else to take care of me, right? And that comes either through whatever, very basic stuff, you know what I mean? Like I'm gonna go with like really basics. Like as a kid, you were taught to do like CPR, and all of these little things have been basically removed from society. When it comes to self-reflection as a process, we've been doing it for millennia in prayer and all these other processes. When it comes to ritualistic behavior, we had a ritual of the walkabout, right? Becoming a man, becoming a woman, the sweet 16. All of these things have been completely taken away from society and pulled, right? So as a society, we look for, let's say, we look for self-worth by someone else telling us that they like us or whatever, a like on your Facebook page or Instagram, whatever. And that's where we are today. And I think what we're seeing is that, we're kind of pulling that back into, okay, if you're such a data-driven society, how much do you know about yourself? Right? And we've known this from the data. People don't care about, living forever and all this like, futuristic hoopla. They care about self-development and self-awareness. And that's really struck a chord with our users, because there's nothing out there that teaches them who they are and at least helps them in that journey of personal development, personal growth. And those who are interested and mature enough to get into that journey, typically 35 plus, they're in that, I call it that, like, you're young enough to have young children, right, in the house, but you're old enough to start taking care of your parents. And you start seeing age, right? And you start seeing what happens as they get old, and you remember how it was to be young, right? So that middle age is really interesting because you can live in those both worlds, and you start recentering yourself. Then you start asking yourself, who am I? What am I? Where have I been? Where am I going? How can I be better? A better leader, a better communicator? And in our product, what we're trying to do with the roadmap is create the dashboard of the human, basically. This is your Google Analytics of a meal, and how do you optimize and what can you do to become a better human being? And that's the mission, really, from a digital twin, from the self-care. Now, how you use that data, and let's say you're sick and you need a doctor, a professional, hey, here's my mind bank for the last year, or here's my, my mental, take a look, let's talk about it. So psychologists and coaches are really taken into it because it becomes data-driven. Right, their process now becomes, at least they have something to look at and as a point of reference, which in the past they never had.
Thanks for that, Emil. Lots there to unpick. And I really like this idea that through data, we can each have a very personalized sort of health map, mental health map, that any clinician could have a look at as well or discuss with us.
Yeah, so definitely.
Tim, thoughts on any of that?
Yeah, I mean, it resonates. Emil's just talking about, I think the phrase that we've used internally is the sandwich generation, isn't it? From a point of view of just, if you think that we're in that space in the market where we're seeing patients that need clinical needs. So we're moving across from the sort of well-being prevention, working well, into that compromised health and ill health, and in some cases more complex health. And actually that spread there from a point of view of what we're seeing, the real drive and demand in children and young people, which probably links really closely to Pete's opening comments around actually what is digital doing in that space that's driving a lot of that. And then the individuals in that sandwich generation in the middle that are working, and then also looking after, a big area of concern for a lot of people is that carer side of things. And I think employers that we're talking to in the insurance industries that we're working with are looking for that ability to provide such a wide net of support for people. So it's really interesting to see that the others are sort of thinking in those same lines. I think from a data perspective, it sort of makes me think about, again, we're a human business, right? So if we think about the core of OneBright, it's about our human network therapists and employed therapists delivering those services to another individual. And it's about the governance and the accreditations that go around that. So I think the building of data sets around these new technologies that give us that evidence base, that allow us to be comfortable when we're delivering clinical interventions is really important for us. So, there's no surprise that we partner with Derek and some of the tools that they have at Silver Cloud, because there's a really strong evidence base around some of the work they've done with the RCTs that have, in our space, we use a lot of the guided online therapy tools, because you've got that comfort that you can deliver that and the outcomes are going to be of a level you need. So yeah, it's an interesting space when you move into where we're delivering our care.
Thanks, Tim. And Derek, you're obviously working closely on a number of the themes that we've just talked through there.
Yeah, I mean, really interesting. I'd like to make 2 points, which I think are, the first is around the ethics and the role of data and ethics. And I thoroughly agree with what's been said around progressing along ethical lines. But it occurs to me, and actually similar to others on the call, look, I have an academic background in terms of research, so I know a lot about ethics and consent. I also have a clinical background, so I know about ethics and consent in that regard. But you know what? Technology has just run at such a pace that ethics are trying to keep up with it. And actually, it's interesting where the discussion mostly focused. It was on the use of data. But actually, there's a huge question and possibly a huge gap in the knowledge we have around data acquisition. Most people in the general public have the clue what's being collected once they pick up their phone and use it, or they strap on their smartwatch, or whatever it might be. And possibly many of us on the call couldn't even describe fully the types of data being collected in terms of being acquired. So I think there's both, we need to look at and publicly educate on what data is being acquired, how and through what means, and what does it mean potentially. And that's a really key thing, because the potential of the use of it is massive and we don't understand it. We can't understand it. And technology, especially in terms of now, you know, the re-emergence of the interest in machine learning and AI, and there's really some interesting stuff being done. But, you know, there are players in the world that will do that in ethical fashion. And there are players in the world, both companies and individuals, that won't. So that's one point I'd like to make, and it's something I think we need to think more about. The second point I'd like to make actually follows on from what Emil was saying in terms of humanity. And, you know, it strikes me at the middle-aged thing. It's really interesting. You have a view on both sides potentially. But actually what struck me while you were talking was, I've noticed, and possibly others have, you know, millennials and Generation Z or whatever they are now, they're coming to the workforce. And yeah, salary and work descriptions are important, but they're also looking for something else. They're looking for purpose and meaning and value and virtue. And I think there's something in that. There's something huge in that in terms of the future of digital. And, you know, I often think myself, I've been working in digital mental health for like almost 2 decades, really, in terms of research and development. But, you know, who's going to design the next thing? And who's going to meet the needs of these generations coming forward that actually, whose needs are very different? You know, most of us, or maybe not most of us, sorry, some of us have grown up basically with pen and paper. You know, many of the generations coming forward have grown up with mouse in hand instead of paper and pen, you know, and the computer screen. You know, there was a number of years ago, I remember someone commenting on the screenagers, you know. So this is, and their values, their value systems. And, you know, the talk about, you know, in olden days, we had community, we had shared stories, myths, which gave purpose, community and collective purpose. And a lot of that has been eroded for different reasons and been replaced by, you know, is my full self-worth just captured in an image right now that's posted on an Instagram page? And where is my locus of control? And how do we get that back for generations coming forward? So there are just some comments on the point so far from my perspective.
Great, thanks, Derek. I just put down my pen and tried to hide the bits of paper I was scribbling on there.
Bring it back, Alistair. Bring it back. Let's bring back the pen. Retro.
But, yes, it's not the first time I've been called retro, Emil. Phil, sorry, Pete, when you said in your introductory remarks that digital held enormous promise for making progress in some of the areas we've touched on. I think everybody was nodding, but you said that digital also might cause some of the issues that we're talking about today as well. Would you like to say something about that?
Yeah, for sure. And I think this is really important, and it almost comes sort of straight on from Derek's comments. We've done a lot of research over the last 10 years, and we've seen teenagers, Gen Zs, millennials, or whatever, spending less time in communities with families, locked to screens, scrolling up and down, spending money in ways that we were never able to do before, impulsively, to create debt, which creates mental health complications like further on, and so on and so forth. There's a huge amount that digital has done in terms of learning more about us, but it's also basically been designed by a whole bunch of people that don't fully understand the human psyche. And I think with that comes a huge amount of complication. Like the social media platforms, in my view, that are causing quite a lot of the harms, which I'll mention in a minute, have largely been created by white middle-aged men who are not the victims of, racism, sexism, ableism, all the problems, all the isms that those social media platforms are also now propagating and creating this kind of mental health tsunami at quite a lot of very vulnerable people. And so I think what we need to do is really just be very, very careful that this amazing thing that we've created to help people with their mental health isn't also in some way pushing the fuel from the bottom forward. I'll give you an example, and just a quick trigger warning for anybody that's on this listening to this that's going to be upset by this. Is I've been doing some expert witness work for a few cases related to teen suicide from social media platforms. The advertising algorithms that are baked into some of these platforms are pushing self-harm content, and teenagers are going into the top of this helix and spiraling quite quickly down this helix of self-harm content because the advertising algorithms are being used to also push the personalization content. The same platforms are also being used to push out messages of hope and well-being and advice and all this amazing stuff that the world also needs, but it's kind of doing this. And so I think we just need to be really, really careful that we're not solving the problem at one end and also creating the problem at the other end. And look, if you think about, and I'll just end on this comment, if you think about it, we're kind of 20 years into this weird experiment right now, and we are in this weird experiment of technology and platforms and innovation. And I think 20 years in the grand scale of humanity isn't a huge amount of time, but we are just learning as we go, but we have to be very, very careful what we're doing, because we are seeing a huge amount of harm being created for very vulnerable people, not just teenagers, but very vulnerable adults as well, because of the behavior that technology is creating within us.
That's really helpful, Pete. I think to give our discussion sort of context and a bit of balance as well. Adam, you've just joined us as a panelist. Would you maybe like to say a few words about yourself and your organisation and your key areas of interest, and then you can, join the conversation more fully?
Sure. And did this start an hour ago? Because I think someone may have gotten the time difference wrong on our scheduling.
Yeah. Hey, if that happened, just you fire away. You fire away now. There'll be plenty of opportunity for you to contribute. So if you could just introduce yourself and say a few words about your organisation and key areas of interest, that would be great.
Yeah, sure. So I'm a co-founder of 1907 Foundation and 1907 Capital. I've been in mental health for 3 years formally. My experience before that was more just personal and family. 1907 Foundation is a grant funder for mental health research. The difference is that we only fund based on biological function, not based on symptom. In my experience, all the issues in mental health have partly stemmed because of how we define these illnesses. An example of that is depression. Is it the cough or is it COVID-19 that's causing the cough, right? And so we fund grants, but we've also built a grant clearinghouse to collaborate with other funders, for profit and nonprofit, for funding this much needed research. And my background is in finance and investing. I've worked in investment banking, private equity, and hedge funds. And 1907 Capital, the relationship between the two is 1907 Capital is actually a for-profit. It's partly owned by the nonprofit. And the reason for that is because of the scalability of for-profits and using profits for a purpose.
Great, thanks very much for that, Adam. And I think we'll come back in the discussion to those links between physical health and mental health. Phil, just before we do that, we touched on personalisation, and it's something that Emil mentioned, and clearly digital and data gives us much more scope to make sure that, all treatments are sort of rifle shots and it isn't one size fits all. I know that that's something you've been working on.
Yeah, very much so. I think, the key, I think, to remember is that every single one of us is different. Every single one of us, has different thought processes, different physiological processes, etc., and that it is very, very difficult to find any form of solution that is the one size fits all. And one thing that we've been looking at is that if we can create a smorgasbord, if you like, of as many issues which can affect people as possible, and then present them in a way, in a trusted, safe and curated environment, people can take and pick the pieces that are relevant to themselves. And we think that one of the key things that we need to do, just genuinely, is break down the stigma that is attached with anything which we believe might make us fearful, harmful, worried, embarrassed, all of those feelings that we struggle with every day. And if we can just present something in a way where somebody can come along and say, okay, I've got concerns about paying my energy bills at the moment, etc., what can I do? Where can I find help? And providing it comes down to that thing I think we mentioned right at the beginning. Can we be more preventative rather than reactive? And can we use technology to help us in that journey? And in order to do that, I think from a personalization point of view, we have to recognize that we are all individuals, and somehow we have to try and recognize that all of us at different times of our lives, different ages, different statuses, etc., need different levels of help. And some of us need very little help, some of us need quite a lot of help, and it's about presenting that in a way where people don't feel stigmatized in reaching out for it at all, whatever stage they're at. So that's why we've sort of gone for this personalization thing, so that we can give people the opportunity to say, I've got a bit of financial issues, I've got, I'm homeschooling kids for God's sake, and that's caused me to have nightmares, etc. All of those things that happen to us on a day in, day out basis that for many of us we have no real control over, but there are people that can support us. And it's a way of, it comes down to, I guess, that thing around connection. If you've, how can we connect? How can we use technology? I know we're obviously all here on a big screen at the moment, being connected, but how can we use this sort of technological breakthrough of connecting people so that you can connect somebody at a very personal level to somebody else that has perhaps got the power to help them and support them, or has even lived through those experiences themselves to give them some form of comfort that they're not alone. So that was the whole point about the personalization, recognizing that we are all different, and there is no blanket approach.
Thanks, Phil. Emil?
Yeah.
Thoughts on that?
There's a lot of thinking there, from a personal story perspective. When Phil was talking about reaching out in times of need and things like that, like I had someone very close to me on January 7th kill themselves, specifically because of this situation. Right, we were in product development, Mind Bank, and I'm killed myself. Like, if we were a bit sooner, would she have not done what she did? But it really came down to trying to do it by herself, right? And the sense of like, I can do this on my own, kind of, I don't know if it was, you know, stigmatism or whatever you want to call it, but I truly think that if you would have put her in front of someone at the right time, it would have turned out differently. Knowing the person, knowing the situation, because it's one of those things where, like, if she would have gotten up and gone to a psychologist, she would have been fine. But it's that step, right? It's that getting up and going, knowing you have a problem, trying to solve it by yourself, and not walking into the door and talking to a psychologist, right? So these are the things that, you know, when Phil was talking, it was just kind of going through my head in terms of, like, you know, the role technology can play in this situation is self-awareness, right? And say, hey, why have I been sad for the last 2 months? Or why is it, you know, I'm sad and then I'm happy and then I'm sad and then I'm happy, and, you know, or when I speak about this topic, this is what's my trigger, whatever it is that makes you more self-aware and empowers you, so that you can then say, okay, I want to take control of my mental health. And I think when it comes to the whole conversation, really, you know, I like to say moving it from mental health to mental strength, right? That's where I like to focus. How do we make people just mentally stronger so they don't need a mental health solution, right? And how do we develop, you know, grit and resistance and resilience and everything that, you know, life throws at you, because it's, you know, the challenge with digitization of society is that everything happens at scale. You know, before you used to hear someone talk crap about you, you know, and one person said something mean about you and it would hurt your day. You're like, oh, that guy or that person. Now it's amplified by comments and likes and shares, and then you're just like overwhelmed, right? And that's the dark side of digital. The bright side of digital is, like, you can then say, okay, well, who am I? What is my data? Where can I go? How do I become more empowered with who I am? And that's where we're trying to focus on. And I guess that's the only thing I can say about that at this particular point in time.
Thanks, Emil. I think that it also raises a question about access to both diagnosis and treatment for mental health, doesn't it? And it strikes me that digital offers those, particularly maybe in disenfranchised communities, the possibility of greater access to services. And I guess if you've got a range of different issues, and maybe, you know, you live in a particularly poor community, or you aren't particularly affluent, a lot of these issues get multiplied pretty quickly, and access to services is an issue. Tom, any thoughts on that from your perspective, using digital to make people more aware of the issues that they might face and the treatment options that might be available to them?
Yeah, I think human capital is a really scarce resource in this industry, and we all know that in all the markets, not just the US, I think globally we just don't have enough personnel to really treat all the you know, the rising tide of this pandemic of a mental health crisis. And so we really need a wide range and plethora of tools, whether that is a pure digital approach or a mixed digital plus human, or a tech-enabled approach. You know, at Valera, it's a tech-enabled service model. We don't treat patients with a pure digital CBT model. We have clinicians, therapists, nurse practitioners, and psychiatrists. But as a company, we use patient-reported outcomes and data, and we serve it up to the providers to actually monitor folks in between visits by using clinically validated assessments like the PHQ-9 or the G87 or the PAN survey, which we kind of monitor patients with schizophrenia and bipolar disorders. But I do think there is a role for various options to really take care of the entirety of the funnel, whether it's mild, moderate, or severe. And I think there is a huge role for technology to create efficiencies, especially operational efficiencies within the system.
Thanks, Tom. Derek, thoughts on that? You know, access to some of the diagnosis and treatment that's out there.
Yeah, certainly in my experience, access has been one thing where digital has really made a difference, where volume, you can achieve volume in the absence of the necessary human resource, which is, you know, scant. So access definitely. However, there's a related term, which is reach. And this is related to who's accessing. And this is still a remaining problem in delivery of digital solutions, because we're still, while more people are accessing services for assessment and treatment, they're still the same type of people. We're not yet penetrating in terms of reach for different populations or sectors of the community, of our different communities. And that's going to be something, it's one of my summary statement points around that, you know, getting further reach with digital. How do we do that? How are we going to achieve that? Really, nobody has an answer yet. Like, really and truly, nobody has an answer. It needs to be answered. However, it's related to, in my view at least, the bit of conversation that was happening previously around personalization. There may be, in my view, a potential opportunity to leverage the technology and data we're acquiring over time to personalize. And for me, personalization boils down to one concept: responsiveness. And responsiveness is effectively responding to what's presented, which is a need. What's the need, and does the solution respond to it? If it doesn't, we're out of there. And that's key. It's like any experience in life. You go on a website today to look for something. If the first page you open doesn't have what you immediately need, you're out of there. That transaction happens everywhere in our lives. And so access, definitely, I think I've seen that. We've seen the potential to increase access. We haven't managed to address reach, to reach those more vulnerable, really in need. The ones, for example, that was described earlier of the individual, oh, I'll do it myself. You know, how do we get to reach that person and bring them from us, you know, I'm just going to do this by myself, to maybe raising a different level of awareness that maybe I actually need something different, or I make the steps towards it. And then potentially, in my view, if we can develop responsive to need transactions into the future, we may get there.
Thanks for that, Derek. Apologies, I've forgotten who it was that mentioned young people and some of the work that they've been doing focusing on young people.
Yeah, I mentioned it.
Was it you, Derek? Would you like to say something about that? Because clearly that's a critically important group.
It really is a critically important group. Given all that's been said here today in terms of even the dangers around technology, it really does affect children and young people more disproportionately, I would say. Even though it does have impact, massive impact in adult populations, I think there's a disproportionate impact. And the reasons are that children and young people are still developing. You know, they're developing in a whole host of ways. So there's a real need for us to develop solutions that can really meet that need. And actually, you know, even Silvercloud, we've developed a suite of programs in the last 18 months for children, teenagers, and parenting. And they're following pretty standard models, you know, which is good. And I think they will have an impact. But I actually also think in the back of my mind, some other Star Wars initiative is needed for the future of delivering effective mental health care for technology savvy children and young people.
Thanks very much, Derek. Adam, when you were introducing yourself, you talked a little bit, I think, about the links between physical health and mental health. Would you like to expand on that?
Yeah, I mean, just hearing some of the other comments, and actually when Emil mentioned this, I wanted to weigh in at the time. So stigma is a big point of conversation, right? And we want to bring people in and have people, speak to other people because it helps them, right? But I think also being realistic, everything, when we talk about mental health in our society, it's always sort of framed as weakness, right? Like no one wants to come out and say that they're weak. And so stigma, even when you look at what's applied, right, by that, is like, I'm not something. Okay, well, I'm a man. I don't, you can tell me, oh, it's okay. Come talk about your feelings. It's okay to not be okay. Like, I'm sorry. I want to go talk to my friends. Like, I don't want to talk to you. And so when Emil said it before, it's, well, what are we promoting here? Is it not being weak, or is it being strong? Right? Are you mentally strong? Or are you not mentally weak? Right? And so we created a program, and it's called Mentally Tough, right? Which is just, think of it as like crowdsourcing, where everyone, especially in this COVID world, is doing their own triathlon and their own run or this or that. And the ties to from mental health to physical health are completely clear, right? You've got a brain. The brain is an organ. The brain is tied to your spinal cord, and your spinal cord is tied to every other part of your body, right? This isn't like a separate domain. This is a completely interlinked system, right? And so it's not that your mental health is separate from your physical health, or one and the same. So how do you bring especially men in, or some people who don't want to talk to other people? It's by promoting doing certain things and not doing other things that are naturally good for you, rather than just saying, let's do talk therapy. And so for me, I mean, from high school forward, fitness has been my meditation. I'm always the most frustrated in my life. And when you think about depression, like a big part of it is, okay, I put in inputs, but I'm not getting outputs, right? Like, oh, I lost my job. I'm applying for jobs. I put in 10 applications a day, but I don't get a job. That's frustrating, right? Now imagine running a 10K, right? I just have to run 1 mile a day, 5 days a week for this week, 2 miles a day, every day for next week. Right. And I think when we use the language stigma, it's kind of hit a point where everyone knows that mental health is part of the conversation. But how do we take that from a negative thing to a positive thing? And so one source of our fundraising is these mentally tough campaigns, where if someone does Taekwondo, we've had children, right, do a fundraiser where for every board that they break, $5 goes to supporting mental health research, right? And I think that's a much more empowering way of going about it than some of these other, just versus a sad, like a sympathy-driven way of fostering community. And just, the other thing is, because I know we keep talking about digital, and it has this negative connotation, but I don't think digital is good or bad. I think digital is just digital, right? And it's how you use it. And I wouldn't say because Facebook and Instagram and all these other services create issues that that digital can't work. Those systems were created to create addiction, right? So what is the currency there? Oh, your currency is followers, right? And how do you get followers? Well, you're promoting being on a vacation, you're promoting, being at some VIP event, right? That's the currency of Instagram and Facebook and those domains. Maybe, right, when you look at something that's not even directly related to mental health, look at Strava, right? Strava is a community of people who are runners and cyclists and triathletes, and they're sharing their, their daily routine and building community that way. So it's really the currency that you promote, and really how the algorithms work for what the algorithms are themselves promoting to then the participants in the system. But yeah, those are some of my thoughts. And look, I because of the direct link, if there's one takeaway from me, it would just be, if we stop separating mental health from physical health and start promoting an avenue of becoming mentally healthy by being physically strong, a lot of problems will naturally solve themselves.
Just assuming that, there are a whole range of links between physical and mental health, as Adam said, how good are we? I know that all of us will be based in different countries. I'm in Scotland at the moment, and I know a few of you are dialing in from probably slightly warmer places than I am. But how good are we at joining up all of the services that the private sector and the public sector provide to make sure that there is a sort of seamless health journey, both physically and mentally, for those people that require treatment or diagnosis? Phil, I don't know if you've got any thoughts on that.
I think it comes down to something that Thomas said. I think that's the lack of human capital. I think in an ideal world, we'd love to be able to seamlessly flow, from the private sector to the public sector to the health providers, etc. But if we're faced, as I think the figures are in UK today, Alistair, I think it came out this morning, I think the NHS faces a 6.6 million backlog for operations and consultations, etc. And I know that even in private consultations, getting hold of somebody quickly is very difficult. And one of the issues that I know we have with general signposting is, it's great to be able to uncover and surface for somebody that might be looking for some support. But if they then reach out to be told, I'm sorry, we can't see you for 9 weeks, or, that's going to be as harmful as not finding that support, to be perfectly frank, in the first place. So I think, in the ideal world, we'd love it, but this has got to be a blended approach. Unless we literally go down completely robotic machine learning and you never ever interact with a human being again, digital has to blend with humans. And unfortunately, in areas where we need skills, particularly around healthcare, it's quite obvious that, I think globally, I don't think it's just a UK problem, we are short, and it's just exasperating.
I guess it touches on another question, and it may have an obvious answer, I don't know. Pete, I don't know if you'd like to maybe respond to this. As we think about innovation and encouraging innovation that might tackle some of the issues that we've touched on, is that driven just by the science, or is it driven much more importantly by the patient experience, or is it both?
It's a tricky one. Just really quickly on the last question, and it leads into the next question, is there is no link between, bedroom champions creating apps for well-being and the public health services that are stretched to capacity. And I think that's also part of the problem, is there is no layer of interoperable data that links Adam's point about physical with Emil's point about, like the mental, there is nothing that binds all this together. And so to answer that next question that you asked, which is what's driving all of this, or what's leading all of this, I think desperation is kind of what's going on at the moment. We are in the Wild West. There is an awful lot of innovation that's happening, but it's largely done, by central organizations that aren't looking at the fringes, or the fringes that aren't worried about central organization and government and healthcare systems, because they see them as slow, cumbersome, the thing that's gone wrong, that's let me down. And so I think innovation is really being driven by frustration, and I don't think it's a good position to be in at all, especially when we're dealing with, you know, mental health, suicide prevention, charities that are stretched, systems that are stretched, like blah, blah, blah. Like desperation should not be the thing that's driving innovation. It should be, what are the problems that need to be solved? What's the best technology to solve those problems? And you have problems looking for technology rather than technology looking for problems. And we probably need to slow down innovation a little bit to get this right. Otherwise, we are going to create more problems than solutions.
Thanks for that, Pete. Derek, thoughts on that? You know, encouraging innovation, but doing it in a way that ensures that, you know, it has the greatest impact and it has longevity as well.
Yeah, no, I agree with what Pete was saying there. Like within the system, possibly a lot of innovation is driven by frustration. But then I also know that outside of any system, there's a lot of great people all around the world that are entrepreneurs, have great creativity, and are going at it in basements and garages, trying to identify the right technology for the problem they're trying to solve. And that takes time, which is a frustrating thing in and of itself. I know even for Silverclad starting off, you know, we were really interested in, you know, we have really good empirically supported treatments for depression, for anxiety disorders. How can we deliver these in a virtual digital environment in a safe and effective way? That takes time to build, to get it right at the user experience level, at the administrative level, at the clinical governance level, et cetera, et cetera. The layers, there's layers to it, and it takes time to build that up. But then you have opportunities across the world in healthcare systems where they have, you know, the NHS is a great example, actually. They're very open to support innovation. Other healthcare systems in the US that I've worked with over the years, where they have innovation departments. Now, they can be a bit disjointed, but at least, you know, there's an attempt to try and facilitate creativity and innovation. But, you know, outside of our healthcare systems, there's a huge amount of innovation and creativity happening. And in digital, for me particularly, and not just mental health, I know in Ireland, for example, and that's where I'm based, we're on a campaign to bring quite a number of creative technologies into moving them from kind of pilot phase into mainstream across the key areas of like cancer, cardiovascular, dermatology, musculoskeletal, mental health. And the vision is 10x. And I know, for example, the companies that are involved in this, they've been on the go for maybe 5, 7, 10 years, some more, and they've demonstrated the ability to do 10x. And therefore they're ready to go to scale. But again, that journey takes some time, doesn't it? I think a lot of us will know that.
Great, thanks for that, Derek. Tim, encouraging innovation in a way that makes sure the whole is greater than the sum of the parts.
Yeah, absolutely, and I think it's a big, still massive area for the digital solutions to try and crack, isn't it? From an engagement point of view, I think we're talking about reach, and there's a huge amount that needs to be done in that area. I think still to try and to crack that engagement piece that allows us to really get some of the preventative solutions, change that mindset. We're talking about sort of self-help, that self-management. And I think digital is going to play a really important part in that space. And I don't think we've got there yet. That's ultimately, you know, if you see some of the usage levels and rates on some fantastic technology that's got some really credible stories behind it, we're still yet getting our people in our employees in our corporates or in our health systems to engage at the levels we really want them to do. So, you know, we're really excited about keeping an eye on how that works. It's not the part of the business that we're developing, but in the short to medium term, I think we all have to recognize that we still need to have that blended approach between using the digital solutions, allowing that innovation, but actually using digital to access the therapies that have the evidence base behind them. And I guess from a digital improvement on mental health assessments, and also talking about that personalization piece that we've been talking about there. There's personalization in content, and there's personalization in how people access their content. But actually, when you get into the delivery of care and the delivery of services, there's got to be that choice for individuals to be able to go down that route of an online CBT therapy, a supported therapy. But actually, when they get to face-to-face and human interactions, it's much more than just matching an individual to the modality of treatment they need. We've really got to be looking at all of the different preferences that individuals have, from outside of the clinical need, the CBT, the counselling, whatever it could be, anxiety or depression. How does an individual engage with another individual? Do they like to talk to someone of their own age group, older, younger? All of these different types of preferences, ethnicity, all of those things. So digital, from our perspective, is really helping to personalise care in that space and make sure that by getting that right, I think some of the statistics, when you look at the prescription of therapy within the NHS, the dropout rate, so after 3-4 sessions, is so different to where we see in our service. And I think that's partly due to that ability to get someone really early using digital tools into the care they need with the right type of solution. And that's where we're going to be focusing our efforts and investment in the short term. But fascinated and inquisitive about how the digital platforms and teams are cracking that engagement piece at the front end and improving the preventative side of things.
Thanks, Tim. Just sort of starting to draw the discussion together. Emil, I'd quite like you to start off. I'm going to ask all the panelists just to say a few words about a clearly very complex series of challenges and opportunities, but pull that together and say something about what you think the maybe 1 or 2 things are that could make a bit of a step change, or the things that you see as the particular priorities to make progress and to move things forward in some of the areas that we've talked about.
Sure. I guess from a philosophical perspective, we always believe in AI-enhanced humanity. And the key word there is humanity. So we touched upon this before about the mind and the body being as one. And we are actually, Mind Bank is the first brand that we launched, but we're actually launching another brand called Body Bank, which is going to combine both physiological and mental data coming from Fitbits and all these other devices to create that mind and body analysis and multimodal analysis of the digital twin that is a human. Because we're diving headfirst into that space, for sure. That is our bread and butter. And then what you look at is like, okay, how do we then look at that human as a personal development journey, right? The needs of a 15-year-old are not the same needs of an 85-year-old. And that is the beauty of in the marketplace, right? All of us have a service that's probably perfect for some point in that journey, right? And the challenge is, how do we connect that dot, right? So that this person kind of goes from one service to another service to another service. And the way we're doing is that we're creating this digital twin decentralized canister that basically is your identity as you progress, and then the microservices will be kind of latching on to it as you go. We don't plan on building all those services. We plan on working with partners to provide value from this personalized data. So now if the person prefers a woman or a man or a teenager or an old person, right? We start getting this information. And ultimately, the whole business model, which is the whole versus Instagram and all these other models, their business model is engagement for clicks, right? Our business model, and I hope all of our business model, is helping humanity move forward, right? That literally is our business model. How do we help humans, the human race? And when we look at product development, the 3 questions I ask: does it help humanity? Is it feasible? And the last step is there money? And the ROI is not even the driver. The ROI is, okay, can we make money from this today or at some other point in time? So if we look at it from a customer journey perspective, and that journey being your personal development, where are you in that journey? Are you in mental strength perspective, or are you needing a mental health perspective, right? Then providing the right service at the right time. And I think with something like the digital twin platform that they're creating, adding this mental and physiological data set, at the very least, we'll have one big piece of the pie, not solved, but at least workable, which is the current state analysis. Where are you today as a human being? What's going on? What's where? And then you or the practitioner or whoever else or the other service can help you on that action journey. How do we create an action? How do we create a therapy plan, or anything else? And I think that's personally, from my perspective, that's the future of our platform. And I hope that's, we can work with some of these partners in helping that customer journey along the way in their personal development.
That's great. Thanks very much, Emil. Tom, sort of final thoughts from you on, the one or two big priorities.
Yeah, I think, in the US market, there's a combination of challenges that really inhibit the growth of this sector, whether it's both from a pure digital therapeutic side or a combination of digital enabled clinical human service side. And one is really reimbursements. And when you have digital access and this model of engagement and interaction and clinical service delivery, that type of the traditional reimbursement model has been a fee for service. I'll see you for 45 minutes, or I'll see you for an encounter, and we will charge the insurance company or charge the government plans for it. And I think we haven't quite yet, the ecosystem haven't quite yet figured out the right reimbursement model that would take into account that traditional fee-for-service model plus some sort of value-based model in terms of outcomes, achieving outcomes, and really thinking about how the patient would benefit rather than this time-based fee-for-service model. And then I think the second thing is really, I think what's unique is that in the United States, we're divided into state lines for licensing to practice. And I think that is, when you have a digital environment, the boundaries are really limitless and is purely physical. And I think licensing issues are, if they can be removed, that could be, a miracle, at least for the ecosystem, to provide better access. So I think those are two priorities that perhaps at least either the government, policymakers, or plans can help with.
Great, thanks very much for that, Tom. Adam, for you, the big priority moving forward?
Well, I mean, just on the topic line, the two things, and kind of keeping in mind everyone's business here. I think if there's two things that I'd summarize, it's accountability and non-clinicians, right? So one is, you go to your provider, they make some recommendations, but clinicians at the end of the day, right, the system, how it works, it's going from visit to script, right? And looking for a solution without having to change much in your life, right? You're told, oh, work out. You're told, eat your greens. You're told, eat healthy. You're told, that this and that is wrong with you. But where's the follow-up from then to your next visit, right? And why does it have to be a clinician who's working with you in that follow-up, right? Like, and going to Emil's point on, we've got all these wearables, so we know what our O2 is, we know what our heart rate is, we know what our body fat level is, we know the amount of physical exercise and our exertion per day, we know our alcohol intake, we know our drug intake. So it's not just the wearables, it's also these objective inputs that we have to bring out. And the biggest issue with the clinical environment is the patient goes to the clinician and everything they say is subjective. Like, how am I going to summarize my health over the last 12 months in 2 minutes, right? Like, why don't you look at the data and make your own determination? And then why don't, between now and the next visit, why don't you have someone who isn't a doctor work with me continuously, a human being, not just digital? Because yeah, we have all these apps that say, good work, you did your activity level today, good work. Like, I don't need to hear that from a computer. I need to know that I have a goal that's objective, that someone tells me to do something and I have to exceed that hurdle, right, month by month, and that I'm accountable to another human being. And that human being doesn't need to be a doctor. I actually think those two things, non-clinicians using that to harvest human capital, right? Yeah, there's a shortage, but there's tons of people who'd love to change careers into something that's more meaningful. Maybe they don't have to go to med school to understand some basic data, right? Or help someone execute their life. Just accountability, like having real metrics that we're defining health with, that we're able to use continuously for follow-up. And I'd actually, on that, because I learned more about my health doing an Ironman than I did, than I did speaking to psychiatrists, frankly, right? Because you learn about the impact of sodium and water and, glucose and like when you need the glucose and blah, 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 right? There's an app called Training Peaks, which I'd recommend you guys check out, because the whole premise of it is that you're taking all this data from wearables. Training Peaks becomes the clearinghouse for that data, and your coach, right, has access to all of your data and is giving you not only a training plan, right, but then they're able to see what you're achieving continuously. But the key for that is that the person on the other hand is a human being, right? So does that coach day by day need to be your doctor? And can your doctor at the end of the day have access to that same data?
Great, thanks for that, Adam. Derek, final thoughts and priorities?
Well, I like the point, Adam. I think we built something of that model into what we've been doing the last decade in mental health by using lower intensity trained coaches, etc. But I'd just like to say 3 little points that I think are important for me, and I think important for the industry in general going forward, and the future of the success of digital health in general and digital mental health as a part of that. One goes back to what I mentioned earlier. We talked about access, nice, but then we also talked about reach in capital letters. We have an ethical responsibility not to recreate the past in terms of healthcare and its exclusion and marginalizing people. We have a responsibility, and I think we should really think hard about it in terms of, those individuals in our community, whether it's because of race, ethnicity, sexual orientation, age, ability, that are not engaged in society as citizens. And that's the reality, but it doesn't have to be the reality in digital health going forward. And in doing so, I think we need to think of diversity. We need to think of the context, the social determinants of health in general, and really bring them in as part of how we're designing, how we're conceptualizing, how we're evolving, and also then the devices and Internet of Things and the data that was mentioned earlier. The second thing is, again, it was mentioned in the conversation around personalization. For me, it boils down to responding to need. As long as we keep accurately responding to need within treatments, we're doing a good job. The ebb and flow of it, of humanity. It has to be captured, and it will never be replaced. There's nothing currently that's going to replace humanity or the input of a human. So it will always be the human in the loop, at least for now. And then the third thing, which is a particular interest for me in terms of some work we're doing, is leveraging accurately the data we're collecting for the purpose of moving and evolving. Like, data is effectively an exponential technology. And we're at, like, never before in mental health have we had the volume of data to be able to learn where it's going next. In the last 50 years, outcomes from mental health treatments have not moved. They've not changed. And there's a number of reasons, but one of them is the lack of data, lack of ability to mine data, gain insights, and effectively modify components of treatment, or modify pathways, or modify the entire treatment if required. So I think that's a very exciting part of the future for me. So they're some of the points, Alistair.
Excellent. Thanks very much for that, Derek. If I can move on and ask you, Phil, for your final thoughts on priority or priorities.
I think I think we should never lose sight of the fact that technology is an enabler and can enable literally anything if we put our minds to it. And I think that's really what we need to focus on. As I think, as Derek was saying there, you know, our well-being is influenced by all sorts of things: community, housing, ethnicity, economy, society, etc. And I think, you know, we need to recognize that, excuse me, that our own well-being, whether it's our mental health or our physical health, can be, you know, influenced by various factors. And technology has a role in helping us, you know, find our way through those factors, be it through connection, connecting us to people, be it through virtual peer groups, whatever it might be. Technology probably already has many of the solutions that we scrabble around for today and we're looking for. And I think the one thing that I would like us to focus on, and I really don't know how we solve this, maybe it's us on this call here, or we put our minds to it, is that we can do so much more with technology, but at a simple level. And by that, I mean, you know, if people are genuinely searching for support in any issue or challenge that they have, their first port of call is probably going to be Dr. Google. You know, and once they've hit Dr. Google, what the heck are they going to get exposed to then? You know, which rabbit hole are they going to go down? Who's going to advise them? Go to YouTube, 17 million videos on our views on this is what you should do here, this is what you should do there. And actually, I think a lot of the issues that we face in terms of people feeling really alone and exposed is that we've actually got information overload. I don't know how many apps there are out there for our well-being, how many apps there are for our training programs that Adam was just mentioning there. How do I know which one's the best one to go to? How do I know which one's going to suit me? You know, it really, we have created this global explosion of data, and yet we're not actually providing particularly good maps and guides through it. So, you know, my plea would be, whatever we do going forward, that we take what we have, and technology and the internet is a phenomenal thing. There's no two ways about it. And going back to Pete's first point, you know, it can do more harm than it can do good, depending on how it's used. And I just hope that somehow we can navigate our way through to say, we have this, it's available to everybody in most instances for getting access. It's free. It's probably the biggest resource ever since the libraries of Alexandria were put together. Everybody can participate in it, but we've got to make sure that the information that's provided is trusted, curated, and safe. And I think if we can do that at some very basic levels, we would then see a knock-on effect going from this, you know, preventative to reactive. If people could find some very simple solutions to some of the issues that they face, and as I say, we don't know the answers to this or how we do it, I don't actually think we need to get to the point where people do need that medical support. We can actually prevent it. There was a survey done relatively recently, certainly in the last, just slightly before the pandemic, of GP surgeries in London. I can't remember how many were involved. It was about 70 or 80. And 17% of the people that came in for essentially, can you help me sleep? Can I have some sleeping tablets? Can you do something? I can't. They actually needed financial support. They didn't need medical support at all. But the outcome of not being able to pay their bills was the stress, the anxiety, etc. Let's go to the GP because that's the first port of call. And that's the one element at the moment that we can trust. We naturally trust our GPs. If somehow we can get that level of trust that we have with GPs and the medical profession and humans onto a digital stage, and we can trust interaction at digital level with that same sort of GP built trust that we've got, I think we will make huge progress in the use of digital to overcome healthcare problems.
That's great. Thanks for that, Phil. Tim, a few words and final thoughts.
Yeah, thank you, Alistair. And Phil, I'd echo your comments there. I think you're absolutely right from the point of view of cracking that trust piece and the ability for individuals to engage at that stage ahead of needing clinical intervention. And I think it's important as well to then understand how digital solutions are fitting within that mental health continuum. So we're actually, and really understanding what we're trying to achieve and what our limitations are with some of the solutions being designed, and understanding where handoffs are with other services, and making sure that that's complete, making sure that where we've got a platform that's focusing on certain elements of well-being and mental health, that it provides access to services at crisis moments. It provides access to other services. It connects to that. And I think the digital developments will play a massive role in that connectivity piece, which goes back to access, and making sure that what we're building and what we're developing is engaging with individuals and giving them the right access to the right solutions. I think it's important to understand that an evidence base behind those solutions is really, really important. It's one thing to say that an intervention, be it nutrition, be it physical health, helps people, but mental health is really, really complex. It's a really complex area, and so we have to be really careful that it doesn't, in some small cases, negatively impact people. So being able to then make sure that that evidence base is behind the solutions we're delivering, who they're delivered to, and what support is outside of that is really important.
Great, thanks for that, Tim. And Pete, you get the final word.
The big finale. I think just to kind of go back, I've got 3 points really. I think we have an obligation to reduce harms, and back to that point that I made earlier about the reduction of certain types of content, what we expose teenagers to, what we expose vulnerable people to online. I think that kind of flows to a few of the points that have been made. But I think coupled with that is this: we need to use the digital tools that we have available to strengthen people's ability to cope. And I think that's another big opportunity that we can use digital and in the mental health and physical health spaces. Like, this stuff is not going away. We have to empower people to cope with the tsunami of weird things that are happening in the world at the moment. So, but then I think the other thing that's really, really important is we need to use digital technology data to really plug and augment the deficit in qualified care that we have at the moment. And I think we haven't really touched on it that much. I imagine, Thomas has probably got more thoughts on this than I do, is that we have really good clinicians out there. We have really good PAs, we have really good psychiatrists, we have really good counselors. They can't cope with everything, but if we empowered them with more data and more, information, they could probably do, more, or at least cope better with what's coming at them. And I think that's really, really important. That's going to mean regulating this space really heavily as well, or at least working with innovators to kind of work out what regulation frameworks are in this space. So I think overwhelmingly it's all very positive, but we do have an obligation, I think, to make this area safe. And I'd love that to happen in the next few years.
Great, thanks very much for that, Pete. And as we close the discussion, on behalf of Health Tech World, I'd just like to thank all of our panelists for what has been, I think, a really stimulating discussion. We've covered a lot of ground, and I can't help but feel that maybe we need to come back and cover some of these topics more singularly in a bit more detail, but that for another day. And thank you for everybody that subscribed and has watched. All the content and the full debate will be available on YouTube next week. We'll make sure that all of the panelists know when it's loaded up so that you can share it with your networks. And the same applies to everybody that's subscribed today. So once again, on behalf of everybody watching, and particularly to our panelists, thanks very much indeed for your time and for contributing so freely today. And have a great weekend.
Thank you, Alistair, for leading the discussion. Cheers. Cheers,
Thanks,
everyone.
Alistair.
Well,
Take care, everyone.
Take care.
Thanks,
Bye-bye.
everybody. Take care.
Thanks.
Bye.